We're in this historic moment where, America's waking up to the fact that it's been the frog in boiling water, slowly getting sicker and sicker and sicker, bankrupting our country with almost $5 trillion in healthcare costs, $1 in $5 of our economy. 80% of it or more is preventable. 99% of Medicare dollars are spent on preventable chronic disease. And never this conversation has happened in the political discourse until now.
Which is a little crazy because you hear people talk about healthcare all the time.
Well, they talk about healthcare as a way of like limiting entitlements or Medicare for all.
Exactly. Everybody's upset about healthcare on some level for some reason, but I haven't heard anybody until recently in the public sphere address like why it's so expensive.
Right. So the question, I'm a functional medicine doctor years ago, and I had a diabetic patient come in. I realized, I can't cure diabetes in my office. It's cured on the farm in the food we grow. It's cured in the food manufacturing process. It's cured by what people buy in the grocery store. It's cured in the kitchen. And so we really have to look at the root causes of our food system and say, why are my patients eating this food? Well, it's because the food system. Well, why do we have the food system we have and the way in which it's operating that drives this chronic disease epidemic, which now is the biggest killer on the planet? Food has outpaced smoking as the number one killer in the world. It kills 11 million people a year. 11 million. It's the biggest killer in the United States. Why does that happen? It's because our policies are driven in large part by industry, by the food industry, the ag industry, the chemical and seed companies. And those are the companies that are profiting. This is the biggest industry in the world. It's over $16 trillion when you aggregate all the food companies, the fast food companies, the agricultural, chemical, and seed companies. And this is an enormous force that's driving our political process. And so a lot of the policies we have, either by, just kind of misalignment of our expectations and incentives of what happened, or because of deliberate actions on the food companies, have actually driven a food system that's making us sick. And we have an illness industrial complex. We have a system that's driving disease, and everybody's profiting from it. And no one's addressed that before.